for 2 to 3 minutes, or for maximum for 4 minutes, not exceeding them, more, and slowly and gently, not too much hard, you can say push, too much hard, press to the patient. It should be slow, it should be light. Then you can release the muscle like this. You can also provide in acute injury, if there is an acute injury, you can also give him ultrasonic therapy, therapeutic ultrasound. Remember, there are two things. What is diagnostic ultrasound, and the other one is therapeutic ultrasound. There is difference between the two. The diagnostic ultrasound, there is an you can say screen, and you have a probe. You have the ultrasonic gel. You put the gel on the ultrasonic probe and make circular movement of the probe on